In medical school, I've really learned very little about the role of environment in children's health and in health at large. Unfortunately, like most medical schools, mine gave maybe at most 5 or 6 hours of course material about it, focusing on lead and maybe some cigarette smoking discussion. And even during residency at Boston Children's, where I trained, I learned a bit about lead and maybe about some pollution and asthma and that association. But even though I was surrounded by a number of people who were doing top flight research in that field, it was actually because I had already done a degree in master's in public policy at the Kennedy School of Government that I became interested in health policy issues in general. And after that residency, I chose to spend an extra year getting some specific training in health policy and children's health policy at that. And I spent a year working on Capitol Hill for Senator Clinton, then Senator Clinton, and just learned a tremendous amount. It was almost as if my eyes were open to a new part of pediatrics that I had never experienced in my career. And that is where I learned about the key role that environment can play in diseases like asthma, even certain developmental disabilities, not to mention some emerging evidence that suggests that obesity and other conditions may be in part due to chemical and other environmental factors. And what drew me the most of all was the fact that policy action can have an impact in the long term that is tremendous for children's health and development in the future. And that really connected a number of interests for me. And it was then that I was recruited to come to Mount Sinai to first train under Phil Landrigan, the chair of my department here in preventive medicine at Mount Sinai. And that set in motion a whole series of interests and research projects and have brought me to where I am today. Sure. So there's what we know and unfortunately what we don't know by comparison. So there are 85 or so thousand chemicals that are widely produced in the environment. The reason I say 85,000 or so is that actually at last count there were 80,000 and 1,000 to 3,000 new chemicals have been brought into production each year. When you talk about just the 2,000 most highly produced chemicals in the environment, the ones that are used in quantities more than 1 million tons a year, fewer than half have any toxicity testing data whatsoever, and fewer than 1/5 have testing data with respect to the impact on children's health and developing brain and other organ systems. So sure, it's important to point out that we know a lot about lead and we've taken care of a lot of lead exposures in the environment, and that has led to tremendous reductions in the number of children who are labeled as having lead poisoning. That is based upon an arbitrary cutoff of blood lead levels more than 10 micrograms per deciliter, the way we define lead poisoning right now. We've made tremendous strides, and to some degree lead has maybe receded from the forefront. But if I were to go into a list of certain chemicals, I could give you a list of what we suspect are issues, and certainly those chemicals may include methylmercury, certain pesticides, certain flame retardants, outdoor air pollutants, just to name a few. Unfortunately, often the research bears out a focus on the chemicals that we know something about as opposed to the many chemicals that we know very little, if nothing at all about. And so we have to be really careful in pointing that out when we're talking about this issue of children's health and the environment. What we know is that asthma is at least in part due to outdoor air pollution exposure besides factors in the home environment like dust, dander, mites in the home. We know that certain developmental disabilities in children are likely to be a product of early life exposure to chemicals like lead and methylmercury and certain pesticides. Certain cancers have been documented to be on the rise. Specifically, I would name testicular cancer, certain leukemias, and certain brain cancers have been documented to increase 30 to 40% or more. In addition, there's some emerging evidence about certain early adolescent and young adult cancers that are thought to be on the rise as well. The evidence for the link between chemical exposures and those conditions is less strong, but it's hard to explain away trends like that to diagnosis or a dramatic transformation in the human genome. You might be able to explain a slower rise or slower change in certain condition patterns, but increases that are that large are probably hard to explain any other way than some other environmental exposure.